Hello, I'm Daniel Williams. I'm going to be talking about Singapore comparing them to the United States and our healthcare system. So before we do that, though, I think it's important that we understand some of the foundations and the philosophy of Singapore healthcare system. So in '93, they came out with these when they were facing some difficulties and some changes in their healthcare landscape. Basically, they want to promote good health because that's going to lower costs. Promote individual responsibility because that's going to lower reliance on the government. Ensure good and affordable health care for everybody. And they want the free market to work. They think the free market works and helps things when helps lower costs and increase productivity. But they also didn't want the government to be shy about stepping in when the free market wasn't working. So, with that in mind, they have this system called 3Ms. They have MediSave, which is kind of like our HSAs. They are mandatory, which ours aren't, of course, but they're mandatory savings accounts that both the employee and the employer pays into. The employee pays between 7.5% and 17%. Employer pays about 5 to 20%, depending on their age. As you get older, you pay less. This isn't insurance, it's your money. It's just an account that the government makes you keep, but you can spend it on any healthcare costs, just like our HSAs. Then they have MediShield, which has recently been changed to MediShield Life. This is basically a high deductible insurance plan. It pays for inpatient stays, certain outpatient things like chemotherapy, radiation, dialysis, things like that. And then they have these integrated shield plans, which are kind of like Medicare Advantage plans. Only it's not just for old people, it's for everybody. Basically, MediShield is ran by the government. Integrated shield plans are ran by private insurers that tell the government that agree with the government that they'll provide everything the government plan does, and they might provide some extra stuff. Of course, that's all extra, costs extra money. And then there's MediFund, which is kind of like our Medicaid, it's just a safety net for the poorest of the poor. So, healthcare Spain, they have a pretty robust healthcare system. You'd think it'd be more expensive, and of course it's not. Per capita spending, they're about a third of us. As a percentage of GDP, they're about a quarter of us. And there's lots of reasons for that, partly because they're smaller, more self-contained. It's a city-state. They're able to kind of keep track of everything a little bit easier. So then, since we're paying so much more, you'd think our life expectancy would be higher. We should be getting better health care. But again, of course, we aren't. Here you can see the women. We started out in 1980, a few years ahead of them in life expectancy. They passed us in the late 90s, early 2000s. Men, it was even earlier in the mid 80s. They passed us, and here it is overall. They're out way ahead of us now. And then, so in 2015, there's a landmark study in the Lancet that talked about healthcare access and quality. So basically, they used these 32 causes of death that the authors felt like could be prevented with good healthcare systems. And they looked at these, and then depending on how much of these causes of deaths happen in your country, they ranked you on a scale from 0 to 100. So again, in 1990, we were about 6 points ahead of them. By 2015, they jumped to 5 points ahead of us. So these 32 things are things like things that are preventable with vaccines, like diphtheria, measles, things like that. Lifestyle diseases like cardiovascular disease, diabetes, things like that should be either preventable or at least very well managed. And then some cancers and things. So now my one issue with this is it doesn't include suicide, which it seems like a no-brainer that would be preventable with good health care. And I don't know if that would help or hurt us compared to Singapore. Singapore's government's very goofy about publishing any data that could make them look bad, so there's no suicide statistics for the country. So chronic disease prevention. So again, because they're a city-state, they have one health promotion board that is their public health agency for the entire country. So this health promotion board has 5 pillars. They work in schools, workplaces, community. They work with technology companies and innovators. And then they're big on innovating from within, so they want their employees to practice good health in their community. So just kind of an example of that whole process there. In 2016, they realized that their diabetes rates and risk factors were going up. So they decided we're going to launch this war on diabetes. So they had a public education in schools. They had focus groups that they asked, what should we do about this? What do you know about this? Got the word out. And then they partnered with community groups and basically said, we want community-based healthy activities to be common. So, and then they incentivized people to do that with like Fitbits. They gave them little grants out for gardens and whatever, just to get people together and outside and move around and stuff, eating healthy. So fluoridated water is a big thing, of course, for a lot of people. Of course, all the science says it's good. So in the U.S., it's about 66% of houses now. When you take out the wells, people with well water, it jumps up to about 75% of the houses have fluoridated water. Singapore, again, because they're a city-state, it's 100%. And interestingly, they were the first country in Asia to fluoridate their water in 1954. And just kind of as an aside, in 1954, the United States only had about 3% of our houses with fluoridated water. So access to care, everyone's guaranteed coverage. Singapore says that they have it. Of course, that was kind of the goal of Obamacare, the Affordable Care Act, and we kind of have made progress with that. So, of course, the Affordable Care Act reduced uninsured rates from about 17% down to about 10% depending on where you look. And with Singapore, we know inequality still exists, but again, like I said, they're very goofy about sharing data that might make them look bad. But out-of-pocket costs are very high. They don't cover preventive care, which might mean that people don't want to go because they're paying out of pocket. And then they kind of went the opposite of us. We said insurance companies have to cover pre-existing conditions. You can't charge extra for it. Singapore in 2015 said they decided that they were going to revamp their MediShield to MediShield Life. And when they did that, they said, we need to pay for this extra stuff that we're doing here, so we're going to charge certain people with pre-existing conditions 30% extra on their premiums for the next 10 years. So, that's just kind of a strange difference there. And when they did this with MediShield, they revamped in MediShield Life, like I said, in 2015. And the Singapore media outlets called that Obamacare for Singapore. It got rid of you used to get phased out of insurance coverage when you were 92. It got rid of that. It got rid of lifetime caps. They still have yearly caps, but they don't have lifetime caps anymore. Increased payments on a lot of things. Just did all kinds of stuff to increase, but it also costs more, of course. So then unemployment. Both countries are fairly low in unemployment. Singapore is one of the lowest in the world. They have been for the past 30 years or so. And, there's a lot of reasons for that. But, other than the Depression, there's not a whole lot, the recession that we had in 2008, we're fairly close to them most of the time. So the key takeaways, like I've been saying, it's a city-state. It's really hard to compare to us. Things are just so much different when it's more of a close-knit, geographically smaller population. And then their healthcare system tries to guarantee that no one will not receive healthcare because of inability to pay. They rely on a mixture of public and private funding to do that.